International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Greetings from the South Pacific. My name is Don Matheson. I'm the Honorary Research Fellow at Massey University in New Zealand. Professor Sharon Friel has written a very insightful article entitled Inequities and the Freedom to Lead a Flourishing and Healthy Life, Issues for Healthy Public Policy. There is widespread acknowledgement of the problems of growing inequity, so it's great to see a focus on effective policy responses. Friel's article outlines the complexities of addressing health inequity, and she concludes that tackling health inequities is political. It requires leadership, political courage, progressive public policy, social struggle and action, and a sound evidence base. In my commentary, I have taken a look at recent global policy initiatives, such as universal health coverage, and explored the extent which it has the necessary requirements to address health inequity as outlined in Friel's paper. Universal health coverage is currently taking centre stage in discussions supporting the health component of the Sustainable Development Goals. The UHC policy is being led by the World Health Organization and the World Bank, alongside other global development agencies. These organizations are not coming fresh to this task, but have a long history of previous attempts to address health inequity, with the bank's focus on poverty and WHO's focus on the right to health. Disagreement as to how to achieve these goals is part of their shared history, with WHO's previous attempt, called Health for All, from the 1980s, being undermined by the actions taken by other development agencies, including the bank. This time round, the organisation's two leaders are showing a degree of political courage and have both seen primary health care as fundamental to achieving health equity. Political courage from the leadership is essential, as the governance arrangements of both organisations is their Achilles heel. The bank's governance is dominated by the developed countries, and WHO's funding is dominated by bilateral arrangements which can weaken its global mandate when it comes to implementation. WHO has the legitimacy, but not the money. The World Bank is better resourced, but lacks the global political legitimacy. On the policy side, the devil will be in the detail. Most developed is a set of indicators, which in their current form are weak on illuminating progress on equity. The understanding of health, as seen through these indicators, is primarily about financial protection and medical services, with less emphasis on prevention and even less on health in all policies. How global indicators balance the need for context-specific solutions and indicators is also unclear. As far as the social movement is concerned, there is no concerted attempt to support the demand side of this equation, so it remains a vulnerable supply-side driven initiative at this stage. The research base on which it sits is still a work in progress. In conclusion, UHC has certainly been established as a political issue of high importance in the context of the SDGs, and some courage is being demonstrated by the two leaders of the lead agencies. The policy itself is less well developed, and the risks of addressing global policy primarily through a global monitoring and targeting mechanism have not been adequately addressed. UHC is a long-term project. There is room and time to develop a stronger equity focus in its implementation. Friel's framing of the approach to address health equity is a useful guide to this task.